Committee on Health and Human Services and Elderly Affairs, to which was referred House Bill 1520 FNA, establishing a family assistant car ownership pilot program in the Department of Health and Human Services. This comes without recommendation. Representative Shapiro moves ought to pass. Chair recognizes Representative Cushman.
Thank you, Mr. Speaker, and thank you, colleagues. This bill would establish a pilot program in the state which would partner with non-governmental organizations to purchase, refurbish, and transfer ownership of used vehicles to certain, what's it called? TANF, also known as cash assistance, welfare recipients. It would appropriate $220,000 to be matched by federal funds. DHHS assumes the overhead to vendors to be 10%, leaving about $396,000 for vehicle purchases at an estimated $20,000 per used vehicle. The pursuit to help alleviate the burdens of people financially struggling is noble, and I commend the sponsors of this bill for their desire to do good. However, there are some reasons why this pilot program is not a good idea. First of all, it's already been done. So it's not really a pilot program. They had a program in this state and it was discontinued, and there are many reasons why that may be. The used car market is incredibly inflationary with limited inventory. The estimated cost for each used vehicle in this program is very high, even in an inflated market. It's not clear that even if a recipient can get off of transitional assistance due to receiving a vehicle, that the $20,000 the state invested in the vehicle would be offset by the decrease in future benefits. That's one of the principal arguments in favor of the bill. Additionally, there are logistical issues with the bill concerning continuing maintenance for the vehicles. With used cars, there's always a likelihood of unforeseen mechanical failure and issues that can result in the vehicle becoming inoperable and requiring extensive costs for repair. If a person can't afford to buy a used car, is it certain they can afford to continue with the maintenance? Even if the vehicle is warranted for a year, every year used cars can cost thousands in repairs. Instead of making monthly payments on brand new cars, people who have used cars are constantly paying to keep it. There's also a limited ability to detect and prevent fraud in this proposed program, as a recipient who takes ownership of a vehicle through the program could turn around and sell it. They do take on full ownership. It's not clear that the program is a wise investment for the state. Due to the many logistical issues it prevents for the government that's charged with carefully handling taxpayer money, programs like this are best left to private charities and private donations. The legislature, like charities to their donors, have a fiduciary duty to the people. There are currently charities in New Hampshire that are doing this. Wheels for Wishes, Helping Hands of America, and Take the Wheel New Hampshire. And there are national organizations that help also. Charities and businesses are working together to meet these needs in the community. My friend is borrowing my car right now. I'm in the Jeep today because she's got the Honda. Our family only owns used cars, by the way, and last month the Jeep got a new starter, new tires. We need that in the winter, so we just put it back on the road. We took it off because it needed repairs, put it back on for the winter. The Honda got tires last year, but it still needs a gauge cluster, which we're having a hard time finding. All I can say is thank God my husband is a mechanic, because the costs to keep our used cars would be even higher than they already are. So I don't see the imperative for this bill. It's not wise, and further, I don't understand why a charity that's meant to help people won't help people in New Hampshire without this bill, as one of the charities that voiced their support for the bill had said. I don't understand why certain nonprofits will offer charity without state funding, but others can't. All of this can be done in the private sector with voluntarily donated funds. If we have organizations that are doing this already, the social workers at the Office of Transitional Assistance should be helping by referring to those charities that exist. This bill creates a program that's not wise investment, and I ask that you would support, I ask that you would vote against the ought to pass motion and support so another motion can be made. Thank you.